what about the lateral part of the tear trough area? These are the layers of the lateral part of the tear trough area, starting from the skin, infraorbital fat, the muscle layer, the deep fat, which is the lateral soft, till the zygomatic bone when I'm talking about the lateral part of the tear trough. What is the main structure here? We have the infraorbital artery here at the level of mid-pupillary line. So simply, if you want to inject supraperiosteal, and sometimes you might use very small aliquots superficial, very small aliquots. Now what about the central part of, or the medial part of the cheek? These are the layers. I'm not going through details. These are the layers when you inject the medial part of the cheek. So what will be the main structure here? We have medially the facial artery, the angular artery, and we have laterally at the lateral orbital margin, we call what is called the zygomaticofacial artery. So if you want to inject, always inject deep, okay? Especially the facial artery or the alar artery in the medial side is the medium level. So please either you inject very superficial or deep, but the best way to when to inject the alar area to inject to reach the bone by a needle. Or you can inject superficially, yes, you can inject it, but always, please, when you inject superficially in areas where we have a main structure, please inject it by cannula, not a needle. Okay, so now what about the lateral part of the cheek? The main arteries. We have superficial temporal artery. We have the transverse artery. We have the zygomaticofacial artery. You should put it in consideration when you inject the lateral cheek. The transverse facial artery, it's the branch from the superficial temporal, around 3 centimeters just below the lateral canthus. This is superficial, this is transverse facial artery. Okay? So, what will be the landmark? How many patients you have with what is called malar mound? Many patients. Is it recommended to inject the malar mound? No, it is no-go area. You shouldn't inject in the malar mound. But what is the benefit of the malar mound? It is simply the landmark of transverse facial artery. It's just below the malar mound. So when we have a malar mound in patient, you have to put in consideration just below the malar mound, you have transverse facial artery. The zygomaticofacial artery, what will be the landmark? This is the artery, just at the zygoma. If you were just to put your hand here, if you want just to feel it, just if you put your hand just over zygoma here, okay, at the lateral orbital margin, you have zygomaticofacial artery. Is it a danger artery? No, I call it a bruising artery. So if you inject at this point to the cheek, if you want to put your needle, please just put it. I see some doctors just put the needle and just move like that and like that and like that. You are doing trauma for the zygomaticofacial artery, so please, just one entry in one point and inject your material. If you will move vigorously in this area, you might cause bruises because of the zygomaticofacial artery. So this is how I say, do not do several passes, otherwise you have bruises. Now, we have the superficial temporal artery. Let me tell you a rule. In any area of the face, when you have a crease, you have a deep artery. When you have a wrinkle, you have a superficial artery. Again, when you have a crease, there must be a deeper structure. Always, at the level of deep arteries, there is poor support. So simply, they might have a crease just above. When you have a wrinkle, you have to think that at this, just below the wrinkle, at the superficial level, you have a superficial or small artery. So now, if you look, if someone just looked to his colleague, you will find here just in front of the tragus, many people, you will see very vertical crease. We call it preauricular crease. At this preauricular crease, it is the course of superficial temporal artery. Again, when you have a crease just a preauricular area, this is where, as this patient, you can see the crease just in the front, just in the preauricular area. This crease, with no doubt, just below the crease here. So simply when you want to inject here or to lift the face by injecting just lateral in front of the ear, please, if you find the crease, go anterior. Do not go inside the crease. And just I heard in the last meeting in IMCAS, doctor just said that he has faced a case of occlusion of superficial temporal artery because one of the doctors just inject a big amount just here without putting in consideration that you have superficial temporal artery. So when you find the crease, please just go anterior and use what you want here. So this is superficial temporal artery at the level of the tragus. It passes like that. It passes from the external carotid just in front of the ear, just below the crease. At the level of the tragus, it goes more medially, about 1.5 centimeter. And then, after 3 centimeter, it will give the frontal branch of the superficial temporal artery, which passes inside the temple. So simply, this is the main landmark. So what would be the landmark here? Just please, if you see the crease, it's okay. If you don't see the crease, just put your fingers like that, just in front of the ear, and inject anterior. Do not inject the 1 finger breadth just anterior to the auricle, just anterior to this point. Because simply just below the finger here, you might face the superficial temporal artery. Now, what will be the layers of the lateral parts of the cheeks? These are the layers. It's quite different, of course, from the medial part because we have here the deep fascia, which is called the parotid masteric fascia, and we have the parotid gland and so on. What will be the danger area? Of course, the parotid gland, the transverse facial artery. We have the superficial temporal artery just in front of the ear. Of course, we have the facial nerve. Simply where to inject superficial in the subcutaneous level. No way to go in perpendicular way here. You must change your direction in subcutaneous level to be safe and just away from the important structure. Now, the alar area, I just talk about it. I will mention it very rapidly. We have in this area what's called piriform space, more advanced. We can say it later on in the advanced course. These are the layers when you inject here in the medial part. So simply, we have the facial artery, transverse facial artery, always, and the best way to inject at the bone. And when I'm talking here in the alar area, inject at the bone, you should touch the bone by the needle. I never inject. If I put my needle, I don't feel the bone, I don't inject. You must feel it, and the patient should feel it. Okay, you feel you have pain? Yes. Okay, it's nice. Because I am in the proper level. Because if I inject more superficially, you might go through the alar artery, which is a branch from the facial artery. Or when you inject superficial, very superficial, subdermal. Why? Because the artery is the middle level. So either you inject deep, and this is the best way and the best results, or you can inject more superficial. This is the level of injection, either deep to the bone or just. You see the artery? Well, I am a level different because the artery is the middle level. You can inject more superficial or you can't inject deep. But a middle level, no way. Subdermal or at the bone level. Now, we have another area with the buccal area. This area is the buccal area. Just we have here the maxilla and the zygomatic bone. Just below this area, around the oral commissure, we have what's called the buccal area of the cheek. The main artery present in this area is the facial artery, around 2 centimeters lateral to the oral commissure. This is the facial artery coming in front of the masseter on his way up. Just 2 centimeters is the course of the facial artery. So simply, this is the area where the facial artery, as I said before, it will be in the subcutaneous level.